Hello, my name is Nicola and today I'm going to be demonstrating the Blue Radiance Peel. The Blue Radiance Peel is a salicylic acid based peel. It is a treatment that we'd recommend a course of four weeks apart. The benefits of having a salicylic peel are the salicylic will dissolve any oil that you may have in your skin while gently increasing the cell turnover. So in the process of between 7 to 14 days your skin cells will appear renewed. It's also perfect for lightening pigmentation, reducing any fine lines and wrinkles you may have, and general texture improvement in the skin. So I'm going to start by using the Obagi Gentle Cleanser. This is going to take off any surface debris and any makeup that our patient may be wearing. It's also going to start the peeling process by prepping the skin. So the next stage of the treatment is the Obagi Blue Peel Radiance Prep Solution. With a little bit of pressure, I'm going to start to apply this in sweeping movements to the face. It's going to start to lower the skin's pH and start to remove any grease that may be on the surface to further prepare the face for the peel. Now I'm just going to apply a little bit of barrier cream at the corner of the eyes to protect them from any possible movement of product into the area. And I'm going to do the corners of the lip, and then I will do the nose last. I always find it's really important when you pop the barrier cream on the nose. I see a lot of the time it gets put around this area here, but if you can see on our model here, we've got lots of little open pores and comedones, and in order for the salicylic to penetrate into that oil and start to break it down, we need to make sure we don't put any barrier on there, and just on the more sensitive areas around the nasal area just here. And now we're going to start to apply the peel. Okay Lucy, I'm going to start on the forehead first. You may find that it'll start to get very active and tingle. I'm going to be asking you on a scale of 1 to 10 how active that tingle feels. 1 to 2, mild, tolerable, 5 to 6, yeah, it's getting a little bit on the warm side. 10 would be, it's a little bit more uncomfortable, Nicola. I would like you to take it off. Okay?
Okay.
And again, pressure. Ready?
Mm-hmm.
The cheeks can be quite sensitive. How's it feeling?
It's tingling.
Where do you think we're at on a scale of 1 to 10?
3.
3. Okay. In just a very short moment, I'm going to start tapping your skin. It's going to confuse the nerve endings.
It's going up. It's tingling. Ooh.
Where are you finding it most uncomfortable? Cheeks?
Yeah.
So as the peel's going onto the skin, you will see that there's a little bit of whitening and frosting that's appearing. So remember, this is a salicylic peel, and that's the salicylic starting to crystallise. Where you see it on the skin straight away is usually a good indication that the person who's receiving the peel is likely to peel in that area. On the first peel, you don't always peel. It depends on how oily your skin is, because the first peel usually has to break through the oil. But with the lady who's on the bed today, we can see she's got a nice little bit of pigmentation across the face, the cheeks and the forehead. So the peel is going to be able to penetrate down to that pigmentation and start to break it down. When this skin peels itself, it encourages the skin cells to turn over. So typically for a young adult, this takes about 28 days. Obviously, the older you are, the longer it can take. But by peeling the skin, we're encouraging that cell turnover to happen a lot quicker. So you reduce that buildup of dead skin cells on the surface, reduces the appearance of pores, fine lines and wrinkles, because you are effectively removing that dead skin. So what you see on the surface is fresher, more brighter and more youthful. Also, the little bit of sensation that the model's experiencing here, that is a controlled injury that we're causing down to the dermal layers of the skin. So what that's going to do is stimulate the production of collagen and elastin. So she's going to get a plumping effect as well over the course of treatments. Lucy, how are you feeling?
Yeah, it's cooling down now.
Cooling down nicely. Now, when you're doing the peeling treatment, you're not limited to how many layers you put on. However, on the first treatment, if we take a look at the skin and consider how the patient's responded, she found it rather hot on the forehead and the cheeks. This little bit of frosting here, I maybe wouldn't touch it again. I would quite like to put a little bit more on her cheeks, but I feel at this stage in the course of treatment, it's a little bit too soon and her skin isn't quite built up for the tolerance yet. How's it feeling?
It's cooled right down, yeah.
Subsided?
Yeah.
So if we were to layer it up, we can put a second layer on approximately 60 seconds later. But with this peel itself, it's self-neutralising, and then when you put the cleanser on, it removes the peel. You don't need to use any bicarbonate like any other peels that you may have heard of before. Should we take it off?
Yeah, thank you.
So I'm going to be using cool water, and you may experience a little bit more activity once the water goes back onto the skin, so that stinging sensation may start to make a reappearance. Okay, so this is the ultra gentle cleanser as well. So Lucy, after today's treatment, if you find your skin starts to peel, don't be tempted to pick it off. We don't want to cause any unwanted darkening of the skin. So if you do find any that peels and it's niggling you, take a pair of little scissors to it and snip it off. Afterwards, I'm going to be making sure that you're going to be using the Ultra Gentle Cleanser, the Hydrate Moisturiser, which has got hydromanil in it, which is lovely and hydrating because you are going to experience a period of dryness after this peel, and also to use the SPF. The SPF's UVA and UVB, so it protects you against aging and burning, but also any other harmful pollutants in the atmosphere, and also radio waves and any light waves that you may get from your mobile phone. If you do that, I can almost guarantee that you're going to be very pleased with the results. Did it activate anymore? Did it get a little bit hotter?
It got a little bit hotter, yeah. It just feels a bit warm now.
Must be quite nice having the cooling pads on after. So if we look here, we can see we've got a little bit of frosting just above the brow, and also just a little bit at the side of that nasal cleft there. Okay, this is the Hydrate Moisturiser with the hydromanil. And as Lucy's got warm tones, we're going to be using the Obagi Sun Shield Broad Spectrum SPF 50 with tint. So any tiny little bit of redness that she may have, it will be calmed slightly from the SPF. Lovely. So if you're to have it done again, Lucy, which I strongly recommend, we'll do it again in about 4 weeks' time. And as the course of peels progresses, we'll find that your skin will overall, the appearance, you'll find textural improvement, you'll find improvement in fine lines and wrinkles. This redness will reduce, and some of this pigmentation will definitely start to lift.
Thank you.